Good evening and welcome. I'm Sheila Balgobin and I am the Dream Decipherer, and I help you to crack the code of your sleep and dreams so you can sleep sound and dream deep. This evening's subject is depression and its relationship with sleep. So, how are depression and sleep related? Evidence is indicate been found that depression and sleep are closely connected and have what is called a bidirectional relationship. In other words, it could be either the depression that causes the sleep problems or the sleep problems that lead to depression. It's sort of a chicken and egg situation. And this, because of the complexity of the relationship, it can be very challenging to know which is actually the issue, the sleep or the depression. But the link is between the two is so clear that in the absence, the actual lack of sleep disturbances, doctors will hesitate to actually prescribe um, medication for depression. The various sleep issues that are connected with depression include insomnia, hypersomnia, which is excessive daytime sleepiness, obstructive sleep apnea or OSA, with insomnia being the most common and estimated to occur in about 75% of people suffering with depression. It is also believed that some 20% of people with depression also suffer with obstructive sleep apnea, where you periodically stop breathing or your breathing is obstructed during the night, while another 15% have hypersomnia. Many people with depression may go back and forth between insomnia and hypersomnia during a single period of depression. So they may be not only lacking sleep, but during the daytime, they're falling asleep because they're just so tired. Sleep issues may contribute to the development of depression through changes in the function of the neurotransmitter serotonin. Sleep disruptions can affect the body's stress system, which disrupts circadian rhythms or your waking and sleep patterns, and increasing the likelihood of depression. In the UK, 1 in 4 people are likely to experience a mental health problem each year in England alone, while 1 in 6 people, the problem may take the form of depression, anxiety, or some combination of the two. Now, most people who have experienced depression know that it is often accompanied by some kind of sleep problem. People with depression may find it difficult to fall asleep and stay asleep during the course of the night. They may also be excessively sleepy during the day or just sleep too much. At the same time, the sleep problems can worsen the effect of depression, leading to this negative spiral or vicious circle between depression and sleep, that which can be tough to break. And poor sleep may even be the cause of depression in some people. So it's important that understanding this complex relationship between sleep and depression is an important step in improving sleep quality and better managing the depression. Fortunately, most people who are treated for major depression often report an improved quality of their sleep. But let's backtrack a little bit. What exactly is depression? It's feelings of sadness, disappointment, or hopelessness. While on a healthy react can be healthy reaction to life's challenges, but these feelings will come in waves. They come and go, um, and will only last a short period of time, and will not interfere with your normal functioning at work, at home, or school. However, with depression, these same feelings will follow a different sort of pattern. When they persist for more than 2 weeks and are felt nearly every day or remain for being felt for most of the day, they may be related to a group of mood disorders called depressive disorders. Also called clinical depression, depressive order disorders include intense feelings of sadness, disappointment, and hopelessness, as well as other emotional, mental, and physical changes that can impair the carrying out of daily activities. What causes depression? The researchers don't actually know. There are a number of factors that can increase the risk of developing the condition. And among these factors include having a personal or family history of depression, experiencing major stress or trauma, such as a death of a loved one or loss of a job or a home. It can also taking certain medications and having specific illnesses may make people fall into a depressive state. Now, family history actually plays a part in about half of the people diagnosed with depression. A person's genetics may affect the functioning of these neurotransmitters, which are the connections between cells, nerve cells. That these connections, the impeding of these neurotransmitters can lead to depression. These neurotransmitters are called serotonin, dopamine, and norepinephrine. The symptoms of depression can include physical changes as well as changes in mood and thoughts, which interfere with normal daily activities. Some of the signs that you may be depressed include persistent sad, low, or irritable mood, feelings of hopelessness, worthlessness, or guilt, or even despair, a loss of interest or pleasure in activities, including sex, decreased energy and fatigue. You have problems concentrating. You suffer, perhaps suffering with insomnia. Either you're not eating or you're eating too much. And you may have darker thoughts that even may be suicidal in nature. So, but the interesting thing about these symptoms is that it will manifest differently in people according to their age and their sex. The way men experience depression is not the way women do, or children, or whether they be young or teenagers. And men will often express irritability and anger, where women will express sadness and guilt. Adolescents may be irritable and have trouble in school, while younger children may pretend to be sick or be worried that a parent may die. And the variations are almost as endless as there are people, but these are some of the typical signs that you will find in these varying age groups and sexes. Now, the next question I get: how is depression actually diagnosed? It can only be diagnosed by a medical professional. So people who think they're experiencing depression should talk with a doctor, a counselor, or it could be someone in a psychiatrist, perhaps, or it could even be if you have a priest or minister that you speak to. They are also trained counselors. You can speak with them. These professionals may be able to suggest tests that can help them to determine whether you're actually depressed or not, but to get a pinpoint what the situation is, and as well as be able to monitor any changes and improvements over time. uh, these professionals may also be able to refer patients to for sleep disorder studies to determine if there's an underlying sleep disorder that may be causing the problem, such as sleep apnea or restless leg syndrome. And these and other underlying problems can lead to depression and worsening of the sleep problems. Now, there are varying kinds of depressive orders, and just a um, to be clear, significant feelings of sadness or loss of interest in normal daily activities is common in all depressive disorders. Specific forms of depression vary based on the severity of the symptoms and the situations in which they develop. The most well known type of major depressive disorder is marked by symptoms that affect a person virtually every single day over an extended period of time, say usually more than 2 weeks. And it commonly involves some kind of sleep disruption. A persistent depressive disorder, which is called dysthymia or chronic depression, may involve fewer symptoms than major depression, but symptoms will last at least 2 years, or in the case of children or adolescents, 1 year. And any symptom free period doesn't last any more than a couple of months. There are other types of depression, such as premenstrual dysphoric disorder and seasonal affective disorder, or SAD, which happens during the winter months when it's darker. But these tend to occur over shorter periods, but can also create significant sleep problems. How and now the next thing is how can depression be treated? And especially now since lockdown, there are findings that 7 to 12-year-olds are showing up with increasing levels of depression or depressive behavior because they can't see their friends, they can't play properly, they can't go to school. They're just finding it very difficult to cope. And it's unfortunately a function of the situation, but there are things that parents and teachers can do to help mitigate that the depression that these older children rather may be feeling. But there are several ways that depression can be approached. The first of which is counseling. It can be positively impacted by several different types of counseling. The biggest poster child for getting people to think differently is CBT, or cognitive behavioral therapy, which helps you to step back a little bit from your thinking and separate your feelings from the thinking, so to change the way you think. And there's also interpersonal therapy, various forms of psychotherapy. There are different ways, different approaches, but CBT, or cognitive behavioral therapy for insomnia, is a particularly type is a particular type of CBT that focuses on being able to manage chronic insomnia. Medications are also often overused and incorrectly used and used for too long, but medication, such as antidepressants, are an effective treatment for depression. Um, these medications usually take time to get into the system, several weeks before there's an improvement in symptoms may be seen. And there may be some juggling. The doctors may have to change your prescriptions to be able to get them to um, get to a prescription strength and dosage and what have you that actually works well for you. And a doctor or psychiatrist can discuss the appropriateness of these medications and make recommendations as to what might be best for you. There's also something a little bit less known, perhaps, and those are brain stimulation therapies. Some people with who are well, some people may be referred to this kind of therapy when medication and other approaches, such as CBT, have not been effective. So some people may consider it ECT or electroconvulsive therapy, which is basically electric shocks, or other more recent types of brain stimulation, such as repetitive transcranial magnetic stimulation, or RTMS, and vagus nerve. The big nerve that runs into the brain. Um, so the vagus nerve stimulation. Now, these treatments can be effective, but can only be provided under the guidance of a trained professional. But treatment isn't limited to just these approaches. There's a number of factors involved in sleeping better and in addressing depression. Um, and in fact, they find that it may be a combination of things, such as perhaps medication and psychotherapy or CBT, that actually show greater rates of improvement than just a single approach. I mean, we're complex beings with complex issues, and there's no one magic silver bullet that's going to be able to resolve the problem necessarily. But there are things that you can do for yourself, and things that can help with it, not only improving sleep, but can also perhaps at the same time improve depression. These things include exercise, and that's been an issue for people under lockdown. Though people are still exercising, it's not perhaps with the same freedom that they had prior to COVID. But exercise, diet, having self care, having, if not therapy, but doing things that just help you to relax and to burn energy during the day so that you sleep better at night. Uh, Making sure you don't eat too heavily at night. So there are different things that you can do. There, exercise, as I said, support. Um, the one of the big problems with people who are suffering with depression is the feelings of isolation. So having a support group, whether that be family, friends, or a formal organization that can help you deal with depression, it's important that you be able to talk about and get your feelings out about your situation, because what we don't express turns inward and actually becomes virulent. It can become migraines at one level. At the most serious levels, it can actually develop into serious disease, life-threatening disease, because that energy has to go someplace. And if you don't express it, it turns inward. The other thing that's really, really important about all of this is that you need to be realistic, and that to realize that even with the best treatment, symptoms of depression may take time to improve, and improve at a gradual level. You didn't get that way overnight, and you won't necessarily be able to beat the problem overnight. So there you have it. There is, as I say, a very there's been growing evidence that the relationship between sleep and depression is a quite tight one. Which ones provokes the other, it's not certain. But in either case, if you are having low moods and you are having sleep problems, it may be well worthwhile to check with your doctor or other health professional, as to whether you're actually clinically depressed, especially if it's lasted longer than 2 weeks. Thank you so much for watching and listening. Have a great evening and start to the week, and I'll see you again soon. Take care. Bye bye.